2:30 is here, so we'll go ahead and get started. Thank you everyone for joining us today. My name is Nikki Forbing-Orr and I will be your moderator. As a reminder, we do have American Sign Language interpretation available today. If you search for ASL interpreter Sarah Hafer and then hover over the three little dots in the window, you can lock it in place. Today we're going to hear remarks from IDHW Director Dave Jeppesen, State Epidemiologist Dr. Christine Hahn, Idaho Immunization Program Manager Sarah Leeds, and our special guest Heather Gagliano, a registered nurse who has done COVID-19 outreach in Hispanic communities in Idaho. When she finishes her remarks, we'll take questions from the media. With that, I will turn it over to Director Jeppesen.
Well, thank you, Nikki, and welcome everyone to our press briefing today. And a special welcome to Heather Gagliano, our special guest who we'll hear from later on. While we continue to see positive trends statewide, the number of cases, hospitalizations, ICU stays, and deaths remain high. Testing positivity declined to 9.2% this past week, marking the 8th week of decline, but still remains above the target of 5%. The number of cases remain high, but are declining. And hospitalizations remain high, but with continued encouraging downward trends. Let's take a look at the statewide hospitalization numbers. And Nikki, if you could share those, would be great. As a reminder, this shows the average daily census starting in June last year. And this data is all ages, including adults and children. The latest numbers are as of Saturday, November 13. For this past week, we remained at high but declining daily average census numbers. 370 COVID-19 patients on average in the hospital last week, 117 COVID-19 patients on average in the ICU, and 63 COVID-19 patients on average on ventilators. Thank you, Nikki, for sharing that chart. With the declining hospitalization numbers, I do anticipate that we are on a path to exit crisis standards of care. However, I do not have a time frame for when that may happen. The decision will be made when the surge of patients being driven by COVID-19 no longer exceeds the healthcare resources available. And we do monitor the situation daily. And as a reminder, moving out of crisis standards of care will not mean that everything goes back to normal immediately. Once we exit crisis standards of care, there will still be some stress on the hospitals, who will likely still be operating in contingency care protocols for some time. And more specifically, that means that it will take some time for hospitals to work through all those delayed surgeries and other treatments. For those of you who are experiencing a delay in medical treatment, my heart goes out to you. I can only imagine how difficult that delay must be. To exit crisis standards of care, we all need to continue to do our part. Now that a COVID-19 vaccine is available for children ages 5 to 11, it's a good time to not only get children those ages vaccinated, but also get the entire family vaccinated, or get a booster shot for those who are eligible. And with that, I'll hand it over to Dr. Hahn.
Thank you, Director. I'd like to start with just a few updates on our work in treatment and prevention, and you'll be hearing more about this at the end of the month, hopefully. But we are working very hard to get ready for 2 new therapeutic drugs that are expected to be authorized by the FDA. I may have mentioned these briefly in the past, but the time is getting closer, and we're working hard to get this all set up. One is the oral antiviral medication. So that will be groundbreaking in that it'll be the first antiviral medication that'll be available for outpatients, kind of like Tamiflu type of thing. And this has been shown to prevent hospitalizations. And so we're very excited about that. It will also it's been purchased by the federal government and allocated through the states in limited supply. And so we're working right now how to get that fairly equitably distributed throughout the state once it's available. And so that work is ongoing. The other medication that we're very, very excited about is a monoclonal antibody mixture. It's 2 monoclonal antibodies together that together can prevent people from getting sick in the first place. And these would be indicated for people with, for example, transplant patients, people with cancer or severely immunosuppressed. We know in those folks, the vaccines do not work as well, even if they get that 3rd dose that's recommended for them. These shots could be given and have been shown to prevent hospitalization and severe illness up to 6 months or maybe even longer. Certainly not a replacement for vaccination, but a supplement to that. We are working to start reaching out to cancer centers and other places where we can place those medications once they're available. So other than that, our primary focus continues to be working to increase vaccination rates among unvaccinated persons, whether that's the newly eligible 5 to 11-year-olds, whether it's people who just haven't been vaccinated yet. And then we are, of course, continuing, as the director alluded to work on booster shots as the holidays draw near. We are going to hear more about vaccination from Sarah Leeds from the Immunization Program shortly, so I will not go into any more detail on that. Our focus today, as you may know, is on the Hispanic population. We wanted to focus in on some of the challenges and also some of the work that's going on to try to hopefully improve health in this population. We know that about 13% of Idaho residents are Hispanic, but our case numbers show that they're about 16% of our cases. So a little bit of a increase in cases. And if you look at that more carefully, you'll see that is mostly because of increased numbers in the working age population, about 18 to 59-year-olds. In that group, we have a higher rates of disease, possibly due to some of the occupations that require a lot of face-to-face interaction with other people and that are hard to work in a socially distanced manner. In addition, we see, according to our vital statistics, that they are disproportionately represented among people dying of COVID, both in 2020 and 2021. In the Idaho population overall, COVID was the third leading cause of death, while in Hispanic population, it was the leading cause of death in both years. And I want to take a moment and thank and acknowledge Audrey Dutton wrote a very nice article on this topic last week that I want to thank her for that information that was put in the Idaho Capital Sun. I think it's a great, nice to see that type of data being used to help inform the public about the serious risk in certain populations. In addition, and Nikki, if you could show the graphic at this point, I also want to point out another issue that we found, and I'll wait till that's, Nikki, let me know when you're, here we go. So the other thing that we've noticed looking at the data a little more carefully, if you look at 2020, you can see here the average age of death among Hispanic residents dying of COVID was 71, whereas in the non-Hispanic population, it was 79. And then in 2021, as it were, it got even more dire among the Hispanic population. Now the average age in 2021 is 64.6. So that's really represents a lot of Hispanic folks dying in their 50s, 40s and 50s and early 60s compared to the non-Hispanic population at 72.7 average age. In addition, the chart below that shows the age-specific distribution of deaths, Hispanic population in green there and non-Hispanic in blue. And each of them are looking at the rate of death among that population, so among Hispanic or non-Hispanic people, respectively. And you can see here up until about age 50, first of all, death rates, of course, are very low, but also they seem to align very closely. But after about age 50, you see a separation and increasing numbers of deaths in the Hispanic population. So thank you, Nikki. So due to this type of information, we really wanted to highlight some of the work that is going on in this area. And so I'm going to turn things over to Sarah and then Heather to talk more about some of the work, some of what's going on now in Idaho. Sarah?
Thank you, Dr. Hahn. So today, my information on COVID vaccination is on data and some rates, including coverage within Idaho's Hispanic population, as well as updated numbers on booster doses administered, and an update on the number of children 5 to 11 years old in Idaho who have received their COVID-19 vaccine. So before I give you those numbers, but let me tell you about our overall data in Idaho's Immunization Information System, which we also call IRIS, on the data that we have on race and ethnicity. The ethnicity category is left blank. In other words, it wasn't provided by the patient among 25.6% of COVID-19 vaccine records in IRIS. So of the remaining 74.4% of COVID-19 records that we have that do include ethnicity information, 66% identify themselves as not Hispanic or Latino, with 8.4% identifying as Hispanic or Latino. Among Hispanic persons represent 11% of Idaho's total population on our dashboard, and they represent 11% right now of our vaccinated population, those what we're saying with at least one dose of COVID vaccine. When we look at additional doses, booster doses or third doses for immunocompromised people, there is a slightly higher booster rate for not Hispanic, people identifying as not Hispanic, compared to Hispanic vaccinations. And for booster doses among the general population, as of yesterday, Idaho providers have administered 173,939 additional doses. That includes both booster doses and third doses for immunocompromised persons. Regarding the newly authorized pediatric vaccine for 5 to 11-year-olds, we are reporting 8,667 doses administered for children in that 5 to 11-year-old age group. And right now, the Bureau of Communicable Disease Prevention and the Immunization Program is in the process of revising the COVID-19 vaccine dashboard, updating numbers and updating some of those pages. Pediatric doses for 5 to 11-year-olds will be included in that revised dashboard, as well as booster dose information on that dashboard, and will be updated on the current update schedule, which for the vaccine dashboard is Monday through Friday by 1 p.m., with the exception of federal holidays. And we expect to have that revised dashboard public sometime next week. And the immunization program remains engaged in long-term efforts and collaborations among providers all around the state and our public health districts to increase COVID-19 vaccination among all Idahoans. That includes those who will start the vaccine series and also efforts to administer booster doses. We know how critical that is to our pandemic response. So that's my update, and I will be happy to answer questions at the end, but right now I will hand it over to our guest speaker, Heather Gagliano.
Thank you so much for letting me come and talk today. I really appreciate that. So I'm Heather Gagliano, and I've been a registered nurse for over 10 years, and currently I'm working with the Idaho Immunization Coalition as a volunteer. And so I'm really excited to talk about the work the Idaho Immunization Coalition has been doing around COVID-19 vaccines. Since early summer, the Idaho Immunization Coalition has been traveling around the southern part of Idaho, conducting listening and mobile vaccine clinics in communities of color and in rural areas. Our main focus has been the Hispanic or Latinx community. This is all possible due to multiple donations, grants, foundations, and contracts. So the Idaho Immunization Coalition, we go out and we wanted to provide COVID-19 vaccines, and we trialed a variety of different vaccine clinic methods and really wanted to lean in to see what was most effective. So some of the methods we tried include doing drive-through vaccine clinics. We would then also go to go into other events that are happening, like a car show, and have a booth where people can receive health screenings along with COVID-19 vaccines. The most successful type of vaccine clinic that we did is where we would partner with trusted community organizations and do vaccine clinics. And prior to the vaccine clinics, we would actually go out into the community and talk to community members about their COVID-19 vaccine questions. And that really is what we found to be the most successful type of vaccine clinic, is we would set up the clinic with that trusted community partner, and we would go out prior to then and talk to people. Different type of partnerships we worked with is we worked with food banks, Community Council of Idaho, a variety of housing authority staff. We worked with them, school districts, to put on these clinics. I was able to work with the Idaho Immunization Coalition Health Equity Coordinator, who's Spanish speaking, when we would go out and do the education prior to the vaccine clinic. So we would have flyers that would tell people in both English and in Spanish about the vaccine clinic, and we would start hanging them up and door knocking. So it was really neat to be able to go out, like, for example, one time we were out in the Wilder area and in the Wilder Housing Authority, and we just knocked on doors and said, hey, we're doing this clinic. Here's the flyer. Do you have any questions about the COVID-19 vaccine? And some people would tell us they've already received it, but they wanted to bring family members to get the vaccine, or some would actually stop us and have conversations. We would stop and have those conversations for however long the people really wanted to talk. So some people had questions that, were just really quick and easy to answer, or some conversations lasted a half an hour, where they had lots of questions. They heard lots of things that they wanted to talk about, and we would take the time to listen and answer their questions that they had. Some of the top concerns that we heard were about vaccine safety. Is the vaccine safe? Which we know the vaccine is very safe. And we would have people ask about their individual health concerns. So is the vaccine safe with my pregnancy? Is the vaccine safe with type 2 diabetes? And I could answer as a nurse saying yes, and our wonderful health equity coordinator would be able to translate that into Spanish. We had people tell us that they heard myths on social media, and so we could individually answer the particular concern that the person had with the myth. And just took that time. We had some people who were just afraid of needles, and so we would be able to talk to them about what we could do to calm them down, help them feel relaxed, whether that's holding their hand, or I pull up a YouTube video and let's watch a video while you're getting vaccinated to help them feel calm and relaxed. One thing that I did hear that was interesting also was I had a couple people stop us while we were walking around and say, hey, I heard that someone passed away after getting the vaccine. And so we would talk and engage in that conversation. It turned out with both people who stopped me that the person actually was unvaccinated and they passed away from COVID-19, unfortunately. But because we were able to have that slow conversation back and forth, we were able to dig down to what really happened. It's so vital for us to have had those partners who are trusted in the community, because as you can imagine, sometimes people still didn't want to talk to myself or the health equity coordinator. We had a group of gentlemen who came to the vaccine clinic, but really they said they didn't want the vaccine and they didn't want to engage in that conversation. And so the health equity coordinator and myself said, that's okay. If you have questions, let us know. The gentleman who was the trusted community organizer really went up to them and had a conversation, and they were really willing to talk to him because they trusted him, they knew him. And about 10 minutes later, the gentleman came over, they had their questions answered from that trusted member of the community and decided to get vaccinated. It was pretty neat to see all this work that you did ahead of time, multiple days, that we would go out and talk to people, and the day of the clinic, recognizing so many people who came in, who we talked to. I really loved that, to be able to say, oh, how are you doing? I remember your puppy. How are you feeling about getting vaccinated? And they said, oh, you answered my questions. Thanks for coming. Thanks for being here. We had some people come and they would ask a couple more questions, and then they'd go back to their house and then bring more family members to come and get vaccinated. The word really got around to people about what we were doing. They said, I heard from a friend that you were coming and giving vaccines, so we came, or I heard from the school district and we came to get vaccinated. After people got vaccinated, they seemed to have this confidence that came over them. You know, they might look a little anxious, and then they received their vaccine and they just took a deep breath. And then they would start calling people or texting people saying, hey, it went really well, you got to come down here. And so they would then be advocating for more people to come and get vaccinated. So the Idaho Immunization Coalition has felt like this model of going out prior to the clinic, educating, answering questions, partnering with trusted community organizations is really successful, and it's been very successful for us, and we want to bring it to all of Idaho and really expand that out. So with that, if anyone has any questions, I look forward to continuing this project and continuing this great work.
Okay, thanks, Heather. So we will now go ahead and open it up to questions from the media. Please raise your hand in WebEx or type your question into the chat area. And then when I say your name, you can go ahead and unmute yourself and then announce your name and media outlet before asking your question. And then remember to clear your hand when you're finished. Let's see here. Well, this is a first. Oh, okay. I was going to say I didn't see any hands raised, but I see Audrey has got her hand up. Audrey?
Hi, Audrey Dutton from the Idaho Capital Sun. This question is for Heather. What is the plan for bringing that program to underserved and rural parts of the state?
That's a great question, because to be able to do that, we have to have a plan. We are really, so through our listening sessions that we're doing, we're also making those connections with those trusted community partners. So we just had another listening session in Pocatello last week where our executive director and the health equity coordinator were able to kind of connect in with other people, other organizations, and really start building that plan on how we can go out and meet those needs of the communities. It's us trying to go out and meet other organizations, or if other people are interested in contacting us, they are more than welcome to, because we love to bring it out to all of Idaho and not just the southern part.
And do you have funding for that?
We have some funding, but we're of course always in the process of looking at other grants, other contracts to help support that. So right now, I can't speak about all the funding since I'm not totally part of that, so I apologize, but I know our executive director does work really closely with different funders to try and have some of this. I know this project's going to expand out to next year too, but I know she's looking at doing additional funding to expand it to the rest of Idaho also. Did that answer your question? Sorry, I'm not into the funding. I'm boots on the ground.
Okay, Audrey said thank you in the chat, so it looks like you answered her question. We'll move on to our next question. Is going to come from Heather Ann Wagner.
Thanks, Nikki. Heather Ann Wagner, KPVI. This is a question about boosters, so anyone can take it who can answer it. I've heard from some people who've gotten the J&J vaccine that are 18 and over that have had trouble getting boosters. Have you heard the same thing since the criteria is different?
Yeah, thank you, Heather Ann. This is Elke, and I will ask Sarah Leeds if she would answer that question.
Yeah, thanks, Elke. I have not heard that as a complaint to the immunization program, but we can certainly look into it. We do have fewer doses of Janssen that we order, but we are ordering what providers do want. So I have not heard that, but we can certainly look into it.
Thank you. I think it was from Johnson & Johnson. They've tried to get different ones, and they've been told, no, they don't qualify if they're not 65 and over.
Well, yeah, we are putting education out there, and we are looking at all kinds of communications with our providers to help them. Some providers are really screening. Trying to think how to, like, they're screening kind of not loosely, but letting people come and say, you know, I'm eligible for the booster based on my age, and not necessarily asking a lot about occupation. And some states are expanding boosters anyway, and so we continue to put communication out to providers about who is eligible and how to administer those booster doses.
Thank you.
Okay, our next question is going to come from Katya Stepovic.
Yeah, hi, this is Katya from KTB Channel 7. Can you hear me okay?
Just barely.
Okay, maybe I should really yell. Can you hear me better now?
Yes, much better.
Okay. My question is, it seems like there is a trend of school districts now dropping the mask mandate, right? And this just comes weeks after we got approval for a vaccine for kids age 5 to 11. Is there concern coming from the state about spread, especially now that we head into the holiday season and gathering? And is this enough time for even all those kids to get vaccinated before they head back to school with no masks?
It's a great question, and I'll start, and then I will turn over to Dr. Hahn for the booster dose and timing piece. Or it's not the booster, but the initial dose and the timing piece. I will start by saying that as we are, I think I talked about this last week as well in the press briefing, that as we're consulting with schools, consulting with the local public health districts, we are supporting the CDC recommendations around masking for K through 12 schools, which says if you are in a community of high transmission, face covering should be worn at all times. So that is the recommendations that we are putting forward. And so, most of the communities in the state of Idaho, most counties are still considered communities of high transmission. And then regarding the timing of the dosing, I'm going to see if Dr. Hahn wants to answer that piece.
Yeah, thank you. Yeah, I agree with Elke. We are very worried about that. We're all eager to get back to normal, and we are worried that as you just heard today from Sarah, we have about a little over 8,000 kids in the 5 to 11 year age group vaccinated, which is just a small fraction of the over 100,000 kids in that age group. So we are worried that it's too hasty. We want to give a chance to get more of those kids vaccinated. Even among older kids, 12 to 17, we're still at about 35% or so fully vaccinated. So we've got a ways to go. And going into the holidays, we know that we're all going to be tempted to go and going and visiting family and having gatherings and being indoors more as it gets colder. So we are concerned. Yeah.
Okay, thanks, Dr. Hahn. Our next question is going to come from Vinny Del-Giudice. Sorry.
Okay, thank you, Nikki. This is Vinny Del-Giudice at the Bloomberg News in Denver. I was wondering, what is the positivity rate in northern Idaho? And can you repeat the statewide positivity rate? And once you start winding down crisis standards of care, do you anticipate some parts of the state will remain in an emergency situation regarding the hospitals, while others will be freed of some of the restrictions, for lack of a better way to put it? Thank you very much.
Great. Thanks, Vinny. I'm going to ask Dr. Turner to address the positivity rate question and then turn the rest of it over to the director, the crisis standards of care piece.
Yeah, thanks, Elke. Vinny, the positivity rate up in the panhandle of Idaho is currently 15.5% for PCR NAT percent positivity.
In the statewide?
In statewide, please.
Oh, in statewide, it's just a little bit over 9%. It's 9. I'll get you the exact number. It's 9.2%. .
Thank you, Dr. Turner. And Vinny, I'll take the second half of that question around crisis standards of care. Just as a reminder, crisis standards of care does not compel a hospital to be in crisis standards of care. It just acknowledges that the conditions exist where they can move into operating to crisis standards of care if needed. As we look across the state, it's entirely possible, just like how we came into crisis standards of care, where we had a regional declaration, specifically up north in the Panhandle, and then later had a statewide declaration. Depending on what's happening in the state, it is possible we could see the same on our way out, where there is a hospital, and there's parts of the regions of the state that are no longer under statewide crisis standards of care, and there are regions that may remain under crisis standards of care. So we'll see how that actually unfolds, but that is a distinct possibility. And the hospital always has the option to operate under crisis standards of care, even if there's not a statewide declaration. A statewide declaration simply provides an acknowledgement, provides the activation of the guidance, it provides the activation of a state entity indicating that situation has been activated across the state. But if indeed we went out of crisis standards of care and a hospital needed to go back into crisis standards of care, we would convene the Crisis Standards of Care Activation Committee and look at activating that either regionally or statewide based on the needs of that hospital. We'd also look to see if there's something we could do as a state to alleviate the problem at that hospital so they can avoid going into crisis standards of care. So the short answer is coming out of crisis standards of care, it could be regional. And if we go out of crisis standards of care and run into trouble in the future, we could go back into crisis standards of care as needed.
Thank you very much. Have a great afternoon.
Okay, we'll move on to our next question, and that's going to come from Rachel Cohen.
Hi, Rachel Cohen with Boise State Public Radio. I have a question based on something Sarah Leeds mentioned. Is Idaho considering opening up booster doses for all adults like a few other states have done recently?
Thanks, Rachel. I can take that. That is always something we're always considering, all options, of course. We have had those conversations, and as we think about that, we want to make sure that we have all of our all the not connections, but all of the conversations that we need to have with ourselves, with the governor's office to make that determination. So yes, we are certainly contemplating what that might look like, but no word on that at this particular point in time.
Elke,
Yes.
I could add, I would say that my comment didn't necessarily refer to expanding, but the current language that ACIP has is there is a lot of, this group should, but then this group may get vaccinated. And so there is some, I guess, for lack of a formal term, some wiggle room in there. So that's what I was referring to in my comment. Thank you.
Okay, our next question is going to come from Katie Clark.
All right, can you hear me okay?
Yes.
Okay. This is Katie Clark from the Idaho Business Review, and I'll preface this by saying I understand this might be an unanswerable question because there may not be enough robust data to see a trend. My question is, with the 5 to 11 and the 12 to 17 populations, was there any indication from the data collected on vaccinations to date if there was an initial surge in vaccination, which then tapered off and plateaued, or like the adult populations, or has it been a steady rate of people going in to get their kids vaccinated for these two age groups? And I think that's probably a Dr. Turner question.
Well, I'll see if I'll ask Dr. Turner first, and then I can turn it over to Sarah Leeds. I think they both can answer that question.
Thanks, Elke. And of course, Sarah can answer this question just as well as I can. And the short answer is yes. There's always those early adopters, and they are all rushing to get vaccinated. So we saw a surge up front, and then it sort of trailed off, and then of course they go back and get their second dose. And so our curve sort of has this sort of kind of wave pattern to it as they go in and get their second doses. So the short answer is yes. I'll ask Sarah if she has anything to add to that.
Kathy, I think you covered it really well.
Okay, our next question is going to come from Kyle Fonensteel.
Thanks. This is Kyle Fonensteel with Idaho Education News Now. I had a question for Director Jeppesen and maybe Dr. Hahn. Following up on the question that Katya asked, a lot of schools are removing mask mandates now. I'm wondering, is it safe for kids to be unmasked in school? And if not, do you know when it will be, and what sort of metrics and guidance that school leaders should look toward for answering that question?
That's a great question, Kyle. That's a tough one. Dr. Hahn, do you want to elaborate any further on your comments, and Director, anything to follow?
I don't know if the director wants to say anything, or I'm happy to. All right, it sounds like not. Yeah, Kyle, absolutely. That's the $1 million question right now, of course. As Katya was alluding to, and as we were talking about, we know that schools and parents and some kids, are very eager to drop any sort of masking that isn't necessary anymore. However, as we've talked about, most of Idaho is still in very high transmission rate, and the guidance is very clear on that is when people should be masking. I think especially as wintertime comes on and people are spending more time indoors, we would continue to endorse that and support it. As those numbers start to change and we see more and more counties that have low transmission, I think that's when we'll start to have those conversations. But it's going to be a complex calculation. I think there's going to be the disease rates in the community. There's going to be things like, is there a new variant? How many kids have gotten vaccinated? And what looks like it's in our future? Do we see a surge coming? Do we see things changing? So I think it's going to be a complicated calculation. I do hope that through the holidays, as we start to see kids starting to get vaccinated, but a lot of gatherings going on and still low immunization rates for the moment, that we would like to see the masking continue while we know that kids are indoors and getting exposed to fairly high rates of COVID in the community and in school potentially.
And Dr. Hahn, I didn't get off mute fast enough, but I think you've covered it well. So.
Okay, we'll move on to our next question, and that's going to come from Ian Stevenson.
Hi, this is Ian with the Idaho Statesman. Somewhat following up on that. So either yesterday or over the weekend, Idaho surpassed 300,000 recorded COVID-19 cases. And by our count, it took the state about 261 days to amass the first 100,000 cases, and then 243 days to amass the next 100,000, and 108 days to add the third 100,000 cases. So I know that a lot of that may be explainable by the Delta variant, but I wondered if there are other factors that you all see that you think have contributed to the sort of rapidly rising rate, and how these cases have been reported over the past year of the pandemic. And then looking forward, do you have any predictions in terms of what we might see at how the rate of new cases progresses as we get into the holidays and afterwards?
That's another big question being posed by you all. I'm going to turn it over to Dr. Turner, but I mean, certainly we can point to some of the behavior changes that people have taken on over the course of the pandemic as well, where we had certainly some strong measures in place, some protective measures with different orders, and then a stronger adherence to the mask requirements, and we saw vaccines come into play. And then we've seen some of the behavior change, that protective behavior change over time with the increase of the Delta variant. So I think that can be part of the explanation, but I'm going to ask Dr. Turner to round out the rest of the response.
Yeah, thanks, Elke. Ian, it's a great question. I think a couple things I would point out is that you'll remember when the pandemic first started, testing was super limited. So we were obviously not counting all the cases that were out there, probably because they weren't getting tested. So we had a slow start to our sort of case counts. So that's part of it. And then, as you mentioned, the Delta variant had immense impact. Its transmissibility is so much greater than the Alpha variant that, you know, one person can infect 12 people versus 2 people. So it's exponentially gonna cause our case rates to go up. So you're spot on that. And then, as Elke mentioned, the behavior has been it's been variable over the course of the pandemic too.
Okay, our next question is going to come from Melissa Davlin.
Thanks, Nikki. Melissa Davlin with Idaho Reports. This is a two-part question for Director Jeppesen. I had asked you last week if you had heard from any lawmakers about potential proposals for this week's reconvened session. I was wondering if that continues to be true, that nobody has reached out to the department to ask for input or guidance on potential policies. Second, I was wondering if the department has any reaction to or has taken any positions on the proposals that are currently making their way through the House.
Yeah, thanks, Melissa. It's certainly a director question. I'll hand it over to him.
All right, thank you. Thank you, Melissa, for the good questions. I'll start with the last one first, and that is, as I mentioned last week, our role is to provide information so that the policymakers, the legislators, can then do their job, which is to pass laws and appropriate money, appropriate both federal and state funds. And so, and I will just say, just in general, that activity has been quite busy in the legislature. It's a little hard to even keep up. But even in a normal session, our job is not to take a position per se on those things, but to provide information as requested and as needed to support policymakers as they make their decisions on what they want to pass. And so that would be certainly the case here. And then I would say that we've had several legislators reach out as they've come back into town on a variety of topics. And I would be remiss to say that legislators do reach out all the time. To the specific question about the specific session, as of last week, we talked about that. That has changed. We've had several legislators reach out to seek some input or information as they've come back to town and prepared themselves for sessions. So again, that's our role, is to provide information to the legislature so they can make the most informed decisions that they can as they set policy.
Thank you so much. Can you give us an idea about some of the topics that lawmakers have reached out to ask about?
Yeah, I think, thank you, Melissa. That's an excellent follow-up question. It's, again, we don't weigh in on the policy side of things. It tends to be more about information. And so a lot of it is clarifying information, both about what the federal mandates are that have come down, as well as just what the situation is with COVID across the state. And so a lot of clarification questions about everything from the vaccines themselves to what our current rates are and what the situation is in hospitals, et cetera.
Thank you.
All righty, we'll move on to our next question, and that is going to come from Audrey Dutton.
Thank you. I'm not sure who this question is for. When I talked with an official at Kootenai Health a couple weeks ago, they had more than 2,000 surgeries and procedures they had to put on hold because of the surge. And there were things like open heart surgeries, like really, really important procedures to be done. What is the kind of scope statewide of the backlog in medically necessary procedures, and how long, this is kind of a three-part question, how long might it take for health systems to work through those backlogs? And then also, what is the potential long-term ramifications of these delays that we'll see in Idaho?
That's a good three-part question there. I'm going to have the director also help me out. I'll take the first go at it here. Certainly, many of the large tertiary hospitals are experiencing those backlogs of cases, just like you learned from Kootenai Health, Audrey. They are certainly, as they're still, we're seeing the case counts come down, their hospitalizations for COVID cases come down, is relieving certainly a lot of pressure on them, or at least some pressure. And giving them the opportunity to prepare for taking some of those cases. They are doing minimal cases, as we've heard for them. Those really kind of most life-saving importance cases. So we're hopeful that as the cases continue, COVID cases continue to go down in the state, they'll be able to kind of pick away at that backlog of cases to provide as much support to those people waiting in line as they can, as the director mentioned at the very beginning. And then Director, I'm going to see if you would like to round that out with the rest of comments. You had some remarks.
Sure. Thank you, Elke, and thank you, Audrey, for the excellent question. This, in my mind, is one of the most pressing topics right now, is really the backlog of medical procedures, primarily surgeries, that have been delayed. You had asked how many there are across the state. The short answer is we don't know the exact number, but we know it's in the thousands. It's a large number. And as you mentioned, Kootenai has shared a number in the past on that as well. As Elke said, I want to just emphasize that life-threatening or critical surgeries have continued, and so I don't know of any situations where we haven't been able to, a hospital has not been able to take care of something that was truly urgent or truly life-threatening. But it's going to take a long time to catch up on that backlog, and so that can, for those patients that are impacted, that's uncomfortable. If you're waiting for a hip replacement and you've been in pain, that's not been great. As you mentioned, if you're waiting for heart surgery, the hospitals have been prioritizing those of urgent versus can wait, but that's still not great news if you need an open heart surgery and you have to wait. That's if you're that person or that family member, that's a pretty tough place to be. And so I do know the hospitals, as they open up on capacity just even a little bit, are trying to go back and really grab those surgeries that are the next most urgent. They've gotten the most urgent, but what's the next tier of urgent? So for example, those open heart surgeries are really trying to get to those types of the cancer surgeries, to get to those things as quickly as possible. So they'll continue to prioritize them up on urgency and how long the person's been waiting and what the state of the disease is that's progressed as they've waited to make those prioritization decisions. And that's happening across the state. We're seeing more and more surgeries taking place. But I do want to just say it's going to take a while. And that actually, I think, is the next most pressing issue as we contemplate coming out of crisis standards of care, is how do we support the hospitals and the hospital staff and the surgery staff and all those that do those procedures to provide as much resources as we can to help them continue. And so that's one point I wanted to end with is, as we contemplate coming out of crisis standards of care, that does not mean that the state is going to be backing away from providing additional resource support to the hospitals. Currently, we have several hundred medical personnel helping out in hospitals across the state, and that will continue. That will continue well into next year, primarily for two reasons. One is to provide relief to the exhausted healthcare workers who need a break. And then the second is to help keep the capacity as high as possible so we can get into this backlog of cases and move through them as quickly as possible.
And are you talking with hospital leaders or healthcare leaders at all about what the kind of long-term consequences could be of folks having to wait months to get these kinds of procedures?
Director, do you want to continue on?
Sure, I'd be happy to. So yeah, yes, and that is, we don't, the short answer to your question, Audrey, is we're not totally sure what the long-term consequences are. And I'm not a qualified healthcare person to actually comment to that directly. I do know that's why the hospitals are working through a priority order of measuring the medical impact to that individually focused on what the medical impact is and working through in that order. And so we'll have to see what that long-term medical impact is. But that is also why we continue to work with the hospitals, as I mentioned in the first part, to continue to provide them resources so that they can work through that as quickly as possible. But at this point, we're not totally sure what the impact is. It could be as minimal as that was really uncomfortable, but the long-term health impact was negligible, if non-existent, or there could be some impact. It's something that we worry about, and we don't know just yet exactly what the impact will be.
Thank you.
Nikki, you're muted.
I'm muted. Have to do that at least once per these meetings, right? Looks like Katie Clark has her hand up. We'll take her question next.
That's got to be a mistake. I don't have a question.
Oh, okay.
Sorry about that.
That's quite all right. It looks like Ian Stevenson has his hand up.
Thanks, Nikki. I just had a question about the trends of COVID-19 patients graph that you all shared at the start of the presentation. In the chat, Dr. Turner said that the 759 hospitalized patients was the week of ending October 2nd. And I just wanted to check for the ICU patients and ventilator patients, were those also that week or were those a little bit earlier?
Dr. Turner, do you know that off the top of your head or?
Yeah, I do know that I have a spreadsheet right in front of me. Ian, the peak of ventilator patients was the week ending October 9th, and that was 127. So that was the week after the peak hospitalizations. And the peak of ventilator patients was the week ending September 25th. So that was the week before the peak hospitalizations.
Okay, thank you, Dr. Turner. Our next question is going to come from Heather Ann Wagner.
Thanks, Nikki. I'm Heather Ann Wagner, KPVI. I just had a quick question about how the children's vaccines are going, if everything was going smoothly and as anticipated, or if there were any hiccups with it. Thank you.
Okay, thanks, Heather Ann. Sarah Leeds, would you like to take that?
I did not hear that question very well. I'm sorry.
Asking how the rollout of the pediatric vaccines is going. Is there any
Thank you.
hiccups?
It has been strong. The rollout has been strong. It was with the different formulation. It was a heavy lift for the immunization program as well as our local public health districts and our providers, but they have done a fantastic job, all of them, as well as this internal Department of Health and Welfare staff, and it's gone really smoothly.
Thank you.
Okay, it looks like that was our last question for the day. I want to thank everyone for joining us today. Our next media briefing will be in 2 weeks, so we will not have a media briefing next week in honor of the Thanksgiving week. So our next briefing will be on November 30th. Thank you, everyone, for joining us today.